Hey everybody, welcome back to Tea Time with Dr. Smith from Accomplished Health and Wellness and Heather Fiore from Free State Nutrition. And Heather's a little under the weather on this rainy day. She has a little bit of cold. We don't have any tea today. We just have water. And if she gets into a coughing spell, then she has her water. So that's always good. So today we are talking about toddler nutrition, right? And all this good stuff. And anything that you want to start out with?
I thought we should kind of mention what's happening with toddlers, like how they're learning how to eat.
Yeah. That's a big thing.
I mean, there's like a lot going on there, right? Yeah. Like from the time they're like
the bolus.
Yeah, like when you first introduce foods to
they gotta taste it.
They have to taste it and they have to figure out how to swallow it, what to do with it, and then they have to figure out how to chew, and then they're getting teeth, and there's like
and that's all uncomfortable. I remember when my kids were learning how to eat. And it's so funny because like more of it came out than went in. It's all coming down. All the peas are everywhere.
And plus they're enjoying the whole sensory experience, right? It's not just about eating this.
Right.
Like, what does it feel like in my hand? What does it feel like in my hair?
Right. You know? What does it look like on mommy?
Yeah. What happens when I throw the bowl?
Oh, on the floor. Yeah. Oh, haha, mommy looks funny because she's like all flipping out. Yeah, it's all great.
Yes, all that stuff is
and the dog loves it too because the dog's looking it up.
Yes.
Yeah.
Right. And then they learn how to feed themselves, right? At some point, they don't want you putting the spoon in their mouth. They want to do it themselves.
No. Yeah, definitely. And then they choke themselves on the spoon because they're like, it doesn't go in any further, dude.
Oh,
you gotta stop.
Yes. Yeah, that's a really good point, is that like kids have a really good gag reflex. Like, of course you should be careful with choking hazards.
Yeah.
But it turns out they do quite often
gag on everything new.
Yes.
New textures, new tastes.
Yes. Yeah. So, you should look out for choking and prevent choking, but
grapes are big. Grapes and hot dogs, because you want to cut them in fours so that they're not round, because a grape is a perfect thing to get lodged in everywhere.
Yeah,
it's not good. So anyways,
so that's that. And then the other big thing is how their appetite varies.
Oh yeah, so like 30% from day to day. Yeah, and they're just kind of, you never know from day to day how much they're going to eat.
Yeah, or meal to meal. Like maybe they're having a growth spurt.
Right.
Or maybe they're learning how to do something else, right? Maybe they're learning how to walk, or maybe they're getting teeth, or maybe they just have their shots. So many things are going on. They're learning so many things that, food maybe isn't like
high on their list.
Yeah, it's just not the thing they want to do that day, and that's okay.
Yeah. We actually see that a lot of times when you'll have, like, say, a chubbier baby. And I always tell my parents, I'm not worried about it. Once they hit between 1 and 2, like the food just is not as big of a deal to them as exploring their environment. It's all about like what's over here and what's going on, and they're moving more. And so they might not necessarily be eating as much, but they're also more active. So a lot happens during that 1 and 2 age group. So we've talked about this before, just about obesity and then underweight. So in kids, we don't really look at BMI. We look at their weight percentile. And so in kids, it's like anyone over 85% is considered overweight, and then greater than 95% is going to be considered obese. But then we also have underweight. So underweight is going to be 2 to 5 percentile is going to be underweight. But really, it's more like, are they staying on their growth curve? Because if you have a small person that, a small baby from the start, and they're staying on that 2% growth curve, that's not really considered underweight. It's when they drop off growth curve. So say they're like on the 10th percentile and now they're at the 2 percentile. That's considered, like a failure to thrive, or underweight, kind of a thing. So
I mean, I think the take-home message
altering
is,
the weight is the new term.
yeah. Oh, I didn't know that one.
Yeah.
Is ask your doctor, ask your child's doctor if you're worried about it. Like,
Yeah.
let them figure it out. Like, don't just assume, oh, because they're not eating now, they're,
Yeah.
you know, they're skinny or whatever you think. Like, just talk to your doctor about it and get the real facts.
Yeah.
Because if you try to base it on how they're eating,
Don't Google it.
no, don't do, never do that.
You know, actually, like if you look at the growth curve, it's actually shaped like that, and it's shaped like that for a reason, because they do start to plateau,
Mm-hmm.
and we start to kind of see that plateau a little bit around between 1 and 2 years. So, a lot of times that's normal. So, you know, so what kinds of like they've had some new changes to, you know, it used to be like no honey until you're a year, no seafood until 2, and no peanuts until 3, or peanuts and maybe peanuts and seafood. Anyways, honey still is nothing till a year. You don't want to give honey to an infant, and that's because of botulism. The honey has botulism in it, and it's not processed correctly in the baby, and so babies can get botulism poisoning. Whereas in adults, we process it fine. So you just don't want to eat out of the, you know, bloated jar thing, or the, not jar, but can, you know.
Yeah. So
that smells gross.
Don't even open it.
But the honey is okay.
Yeah.
When you're over 1. But peanuts and stuff, anything peanutty, you're actually supposed to introduce early now because of allergies. So they say what moderate to severe eczema, anyone with moderate to severe eczema, you introduce peanut containing things like peanut butter, not peanuts, because they can't chew. Hello, you know.
Maybe peanut flour?
Yeah, or peanut butter, you know. And that's like 4 months.
Yeah, so crazy.
Yeah, and then if it's like mild eczema, then you can wait till 6 months. So that's kind of a new thing, and that's also with seafood as well. You can start to introduce that, and it's because they want you to get it in early before the immune system is full blown, so that the immune system isn't like creating that allergy that they're prone to. So
yeah.
Anyways,
I think it's a good rule of thumb to just think about, you know, making sure your kid gets exposed to lots of different things.
Oh yeah.
Right? Like, you know, you might be on some particular diet where you're, you know, limiting this or that, or you cut out food groups, which is a whole other topic that we've already discussed.
A lot.
Not recommended. But definitely not for your kids. Like, kids need to get a little bit of everything. And the other thing is that the same time period, like between 1 and 2, or, you know, 2.5 or so, kids start to kind of shut down and get really limited in terms of new stuff that they're willing to try. So you really want to get it in there right away. Like, expose them to as many things as possible during that like honeymoon period. Yeah,
when they're more open-minded.
They're just going to eat everything.
Like, what is this? I don't know. Ew, I don't know that I like that.
Yes.
Yeah.
So know that they're going to stop doing that at some point. And it's not because they're picky, it's because they're normal toddlers.
Yeah. So what about if we talk about like timeline of introducing things? So like, let's see, cow's milk, right?
Yes.
So we introduce whole milk at 1. And before that, it's breastfed. Breast is best, is what they say. I say fed is best.
That is good.
We don't want any starving babies. So, you know, breast milk or formula, whichever, up until they're a year, and then you can transition over to whole milk. And then it's whole milk, right, until they're 2. Yeah. And then you can drop down. That's KCR. He's our new trusty sidekick. He doesn't really sidekick with us, though. He just hangs in the back. Do you have somebody? Okay. We're going to have another trusty sidekick that's going to go back there. So, anyways, we might actually just go back. Do you want to go back to your office?
Right now?
We can walk back there. I don't know. We'll ask him close to. Yeah, we'll just do that. Okay. He's gonna walk through with his trusty sidekick. And then, can you close the door? Can you close the door when you go in there?
Oh, yeah.
Okay, perfect. He's gonna close the door. Trusty sidekick number 1 and 2. All right.
But that's a good point about the milk, because it's a good time when you're switching over to cow milk to switch over to a cup or a sippy cup.
Yes.
Get rid of those bottles.
Yes. And that's another thing, juice, like juice. You should never give that in a bottle or a sippy cup, because that sugar gets all in there. And then I just keep sucking on it. And then guess what? Tooth decay. We don't want that.
Even though they're baby teeth, it's still no good.
Yeah, because actually baby teeth decay actually also correlates to adult teeth decay. Yeah, so we don't want that. So, and there's limits, right, to how much juice you should get. So, what is it, like 4 to 6 ounces a day when you're 4 to 6 years. 4 to 6 ounces. There you go.
That's easy.
Easy. And then under 4, like between 1. So nobody under 1 should be getting juice, period. None. And it should be 100% juice, not like that stuff that is 20% juice that we all know the name of and has juice in it. Name. And so, but once you turn a year, like 1 to 3 years, then it's 4 ounces, right?
Right.
So
Right. That's a cup.
that's like this much.
It's a very little amount.
Your bottle should not be filled with juice. Just saying.
Right. So all throughout the day, water is really the best thing.
Water.
If you're going to have your kid drinking stuff throughout, it should be water. Milk, because milk has limits too, right? So you only want to have, 2 cups a day for kids.
Yes.
2 cups or 16 ounces.
Yeah, it's like 16 ounces, right? Yeah.
So you really don't want to drink that all day long either.
No.
And if you do, it's not that milk itself is bad. It's just going to replace other things.
Right.
It's going to fill up those tiny little bellies.
They're not going to eat.
And they're not going to eat, and they're probably going to miss out on iron.
Yes.
They're often iron deficient.
Yeah. Well, and that's the thing. Like, that's why you don't introduce whole milk before age 1, because their gut isn't mature enough to be able to process it. And what happens is it causes these micro bleeds, and it's enough bleeding that can cause anemia or low blood count, but it's not enough bleeding that you would actually see in the stool.
Wow.
Yeah. So definitely no whole milk before a year. It's after a year, and then it's limited, 16 ounces. They all want more.
They do.
And they want it before bedtime, and you're not supposed to do it then either, because they need to brush their teeth.
Because milk has sugar in it too.
Sugars, yes. So what else? Fat. Should we be limiting fat intake before a year? Right? Because it's really important for their neurologic development. They need that fat. They need it. Let them have the fat. But then what happens from like 1 to 3 years? Then what do? We limit it a little bit.
A little bit. You kind of ease into getting more lower fat.
Yeah, it's like 30 to 40% of your total daily energy intake. And I think of that like, what the heck is 30% of their daily energy? I have no idea. I wish I could bottle their energy and then sell it, because that would be so much better than Red Bull. Right?
Toddler energy.
Yes,
Yes.
we could call it that, the toddler energy drink. Don't give it to your toddler.
No.
And check with your doctor beforehand, because you might have a heart attack. So yeah, but they should get polyunsaturated and monounsaturated fats, right? But no trans fats. We're all anti-trans fats. And what is that other? So like when you're reading the ingredients list, and they have to have like, it has to be 0.5 grams of trans fats in order to actually be on the label as trans fats. But you can look for hydrogenated oils.
Right. But I think now the
They're
rule
supposed
is
to be taken
it's
out.
supposed to be all gone.
Yeah.
I mean, I would check the
We'll see.
labels, but it should be all gone.
It's supposed to be.
Yeah.
I haven't looked.
I haven't either.
Yeah. What about protein? How much protein do you think when they're? I was kind of surprised by the amount. It wasn't. It was like 5 to 20% from 1 to 3 years, and I was kind of surprised because I would think, they're building muscle and everything, they would need more protein, but no, they need more carbs. You know why they need more carbs? Because they're constantly moving.
There's that
Yeah.
toddler energy.
Yeah.
Fueled by carbs.
They had this experiment that what they did was they took this room, right? And then they put in it adult-sized toddler things. So like it was like what the stairs would be like,
oh my
equivalent
gosh.
to a toddler for an adult, right?
Yeah.
And then like just all these normal things that were in your house, but that were like they made it into adult size. And then they took these athletes and they put them in this room and they said, have fun for an hour. And they were like sweating bullets. And we asked our kids to like walk up the stairs with us, and the stairs are like
it's exhausting.
As big as their leg,
right?
And they're like hiking up. And so then they asked these adults to do it, and they were exhausted.
So it's interesting because they are so little. Like they need more energy, proportionally, but the amount is still not a lot because it's little. So sometimes it's helpful to think about like what a portion size is for toddlers because they should eat. But sometimes, as parents, we always worry like they're getting enough and they didn't eat much and all this stuff. Well, a serving size for most foods is a tablespoon per year.
Oh.
So that's not a lot.
Yeah, it really isn't. Well, and that's why those plates are like this big, kid plates, right? Because that was another important thing is that they should not be eating off of adult plates, right? They should be eating off of the small kid plate. And we shouldn't be saying clean your plate.
No.
Especially if it's like, 2 tablespoons for a 2-year-old.
Yeah.
Is that like of each thing?
Yeah, so like pretty much. Not that you only need 1 serving of each thing each meal, but just to give you an idea of like what's 1 serving, right?
So that's why my little dude, when I put like 1 serving or 1 tablespoon of hummus, and he will eat that, and then he's like almost done. Yeah. Like, dude, you didn't hardly eat anything but the hummus.
That's all you need.
And that's all he wanted. Right. And then he's like off to play. Yeah.
Yeah.
That explains a lot, actually. So, when you're putting that big piece of lasagna on there and they don't eat it all, that's because their stomach isn't real. Yeah. Yeah.
It's not. It is so important that we don't interfere with their
signals.
Their signals. They know.
They
how
know what
much
they need.
They
know. They are so good. Like, I look at my daughter all the time, and I am like, what do you mean you can't finish that bowl of ice cream?
Right. What's wrong with you?
I so wish I could say that. I'm done. Same with that ice cream.
Right.
I'm like, don't waste that ice cream. I'll eat it myself.
Yeah, they know. They will stop. They don't care if there's 1 bite or 18 bites left. They're done.
Yeah.
When they're done. And
I wish I had that
willpower.
willpower. Yeah, I know, right? And so, the carbs, when we were talking about carbs, and that's like their biggest category, it was like 45 to 65% should be carbs. And but where do the carbs come from? So your carbs should come from veggies and whole grains, beans and lentils. So that's not really where most of our kids' carbs are coming from.
And fruit.
And fruit, yeah, fruits and veggies, yeah, definitely. Whole grains and all that. Yeah.
So just like where we should be getting our carbs from.
Exactly. And then also fiber, because fiber is going to hang out longer. And so I was interested to know that they actually have 14 grams per 1,000. It's like 5 grams per day of, wait, 14 grams per 1,000 kilograms, or the age plus 5 grams. Because I was like, who knows that, right?
Right.
But the age plus 5 grams. So if you're 2, it would be 7 grams a day.
Of fiber, right.
So when
It's
you're
not a lot.
100, it should be 105. No, just kidding.
Right. That's just for kids.
Right. Could you imagine everyone to have diarrhea or really bad constipation because they don't drink enough?
Yeah.
That would be bad. So also we shouldn't feed them to soothe them, right?
Right. Yes.
Yeah. You see that a lot with infants.
Mhm.
They cry, and then the first thing that they think of is give them the bottle. But that is not the first thing you should think of. Is maybe give them a pacifier and see.
Right.
Because they might just need to soothe. And if you get them in the habit of eating, then that sets them up for a whole world
Right.
of
I mean, maybe they're
struggles.
sleepy, right?
Right?
So now you've taught them that the milk that they suck on a bottle to put themselves to sleep, and now you wonder why a toddler wants a bottle to go to bed.
Yeah,
So
that's tough.
if you can recognize your infant's, cues, what they're telling you, just assume
And they
it's a
have
bottle
different cries for different things, actually. If you can figure that out, which usually you can, they do have to. They tell you in their own little way. And we already said don't clear a plate. Oh yeah, what is this? Don't punish with food. Do people do that?
Well, it's not like, you're going to eat this because you've been bad. It's more like you can't eat that. Like you can't have dessert because you misbehaved.
Oh,
that's what it is.
I do that.
A lot of people do. I mean, it works, and it's just like the whole thing with getting candy for potty training. I mean, we use food all the time because it's effective, but it doesn't help kids.
Our dogs too.
I know, I mean, it works, but it doesn't help you have a good relationship with food is the problem, right? It just teaches you that,
But we aren't supposed to give them dessert if they're naughty.
No, well, it shouldn't matter.
They should get their dessert regardless.
Sure, you should decide when.
Oh, they should just go to bed early.
You could just decide it's not.
Nobody gets dessert tonight.
It's not dessert night. You don't have dessert every single night, do you?
No, I don't.
So you could decide ahead of time. Okay, we're having dessert on these nights.
All these kids have been naughty. There's no dessert tonight. They don't know it.
But that shouldn't be the connection made.
I gotcha.
Food is not a reward or a punishment.
Okay. So how should we reward them for peeing in the potty? So I'm dealing with this right now. It's a struggle.
What about like a sticker chart that leads to something?
Oh, I could do a sticker chart. Yeah, sticker chart it is.
Okay, done.
Yeah, that was easy. Okay. What about? Oh yeah, we already talked about portion sizes. I was interested to read about don't let them graze or have frequent snacks. But little kids, they just don't eat. They don't eat a lot, so they eat often. So how do you not let them graze?
So the first thing is that most of the time, meals and snacks should be at the table, right?
Sure.
They shouldn't be like walking around playing and eating.
Or in my bedroom. No food in the bedroom.
No.
I don't even eat in the bedroom. Food.
Yes, no. Food should happen in the kitchen at designated times.
Yeah.
And the parents are in charge of, not only what is being served, but when.
Right.
So, but for toddlers, it's true that they need to eat pretty often. Every 2 to 3 hours, you should be offering a meal or snack. Yeah. But the grazing is when it's like one meal or snack turns into the next, and they're just constantly. I mean, first
they're
of all,
like always.
Yeah, it's not good for their teeth.
Yeah.
They don't get hungry or full because they're just constantly like grabbing a little this or that.
Yeah.
And it's easy to fall into that because they like to eat so often and because they're so easily distracted. And, when they eat slow and it takes forever, right?
Tell me about it.
So
and then they think it's fun to throw it on the floor and feed the dog.
Right. So then, then that meal is done.
Right.
Like, okay.
I am so done with that.
You're all done with that. You're not coming back. Like, don't allow them to get down and then get back up again.
Yeah, no, I take the plate away and then they cry and I'm like, dude.
Yeah.
We were eating. Where were you?
Right. You missed it. You can come back next time.
Yeah.
There's a meal right around the corner in a couple
Yeah,
of hours. Yeah.
Good point.
But it is really hard to institute that. Like kids
Mhm.
should sit at the table and you should sit with them.
Yeah.
Like it is
You
so
need to model
tempting,
the
right?
behavior, right?
You need to model, but
Yeah.
it's so tempting to like put them in the high chair, you throw
Mhm.
some food on their tray, and then you go do stuff.
Yeah.
Right?
Right.
Maybe you're washing the dishes or you're cooking the next meal or whatever you're doing. Sit
Yeah.
down with your
Yeah.
toddler and
I try to
eat
trick
with
them. I'm like, oh, that's my bite.
Right. But
My
if
son's like, give me that back, mommy.
that's mine.
Mommy, mine.
They don't want to share.
Yeah.
But it's so important that they see you eating
Healthy stuff.
healthy, normal stuff that they are then going to like eat someday.
Yeah.
You know, and as they get older, they get to eat more of what the similar or same thing that you're eating.
Yeah.
And they want to eat it. But if they never see you eating it, if they're always eating at a different time than you,
Yeah.
they don't get that.
Yeah.
So you really want to make sure you sit down as a family.
Yeah, and you know what helps? Also, my daughter, I know, like my kids, one will like something and the other one won't. Period.
Mm-hmm.
And it's never ending. And then there's Dean, and he doesn't. I'm always surprised if he does like something.
Mm-hmm.
So then Emmeline, my middle one, she goes, Dean, eat this. This is my favorite. This is my favorite. You gotta try it. It's so yummy. Come on.
Does that work?
And then sometimes he'll try it.
Nice.
And then he'll like give it to me.
Yeah.
But at least he tried it, you know. And you know, he's a hummus freak, so he actually steals everyone's hummus. And yeah, that's just how he is. He likes hummus. So I always have some hummus, but then he also gets everything else.
Right.
Because, you know, you gotta give it all. They have to be able to see it all those times, like you say.
Yes.
And then maybe he'll put it in his mouth one time and doesn't like the texture and it comes out.
Mm-hmm. Right. But they need multiple exposures. So, you know, try to avoid, you know, taking something off the menu just because, you know, you gave them to them once or twice and they didn't go for it. Like they need to see it before they even taste it. They might need to see something new and unusual, like multiple times, like 10 or 20 times.
Yeah.
And then they might decide to put it in their mouth. And even then they need multiple times of that before they
might eat it. Yeah. So here's my big question. What do you do when you get home, right? And you just picked them all up from school and daycare and you get home and you're trying to make dinner and they're crying.
Mm-hmm.
And like,
yeah.
Give me some paper spoon or whatever, you know. Fruit snack, paper spoon.
Right.
You know, what do you do? Cheese.
So the ideal situation, and I appreciate that this is not always what's going to work out, but ideally what you do is you have some like fruits and vegetables, maybe a little piece of cheese or something, like, you know, stuff you could just put out, like fruits and vegetables.
So it's okay to do that.
They're not going to disrupt their, you know, appetite for meals, right? So that would be the perfect stuff to put out. Or maybe it's stuff you were going to serve at dinner and they just happen to get it earlier.
Yeah, that's a good idea. So like peanut butter and banana or something.
Sure.
Okay.
Yeah.
I'm going to do that.
Yeah. But, you know, if it's right before
Or
a meal, you go easy on the peanut butter or cheese or something.
Yeah.
Because
then it's going to film.
Then it's going to film up.
Yeah.
So you know, it's mostly about fruits and vegetables and stuff. It's just to tide them over for a short bit. But if it's more than an hour, then yeah.
Yeah, it's going to be more than an hour.
Mm-hmm. Yeah, go for it.
Usually I'm like, oh, I can't make anything because you guys are climbing on me. It takes me forever.
Yeah. So this is where like pre-prep prepping really helps. If
Yeah.
you know, if you can do it and you
Yeah.
have that stuff all ready to go and you just you put it out.
I wish I could do that.
Lifesaver. Mm-hmm.
I just, my weekend never comes out that way. So I don't know. What else?
Oh, what about salt? Salt is a really important thing because like flavor is really important for toddlers. We shouldn't be afraid of flavor. They don't need to eat bland food. I mean,
they need spice.
they're people just
and
like we are. Yeah. But they don't need salt. And the sooner you introduce salt, the sooner they get used to it and accustomed, and then they want it. But if you don't introduce it, they don't miss it.
My kids are a little bit mediocre on the salt. My son, he likes to ruin his meal with salt, and it goes, and then you can see it, and then he has a reason not to eat it.
Yeah.
And my daughter is kind of like, my youngest daughter, she's like, well, I think this needs salt, and then she'll use some, but then half the time she doesn't. So I'm like, okay, whatever. My older one, she's the same way. So they're not like really saltaholic. I'm not a saltaholic.
Yeah.
I don't put a lot of salt in things either, because I feel like if you need it salted,
Yeah, you put it on top.
yeah,
That's a good way to do it.
Yeah.
But we naturally like sweet as babies, right? We have a propensity towards sweet, but we don't have that propensity towards salt. It's learned. So the longer you can delay that, the better. Which means,
how long should we delay it?
Like as long as, like, forever if you can, which is obviously not going to happen, but as long as you can, because they don't need it and they don't miss it.
Right.
So as soon as they start having it, like when you introduce, processed food or fast food, like then they start to like, oh, this is interesting. I like this, and then they want it.
My mom was a saltaholic, and so I remember I don't know, I think I was in high school or something. I just stopped eating salt for a while. It took me a couple weeks. And then after that, I was like, I could put it on, I could put it off.
Yeah, you kind of reset your taste buds.
Yeah. So the other thing about, like, when you're saying about sometimes you have to introduce the food so often, before they try it. But you can also pair them, right, with other foods. Like that helps to associate.
Oh, yeah.
Like yummy with new stuff.
Right. Like if they like hummus, then serve it with hummus.
Yeah.
Or they like other kinds of dips. Or, anytime you can pair it with something familiar, then that helps. Or just try it different ways, right? Like it's cooked or it's raw, it's cut like this, or it's cut like that, or it's with dip or it's not,
I tell my son hey, dip your green beans in the hummus. It's yummy. But it is to him.
Not bad.
So hey, he eats it that way. And then what about food chaining, where you like present the same, like a new one that has a similar texture or something or taste as an old one? Does that work?
Oh. What do you mean? Like say they're like French fries, so you put something else like in the shape of French fry?
Yeah, like zucchini. Yeah. What do you think? Would that work?
I think it can sometimes work. I mean, every kid's different, right?
Unfortunately.
So the same tricks that work for one,
they never follow the book. It's annoying.
It is. It is. But the important thing for parents is just to kind of like try to stay relaxed, right? Repetition is your friend.
Yeah.
And try not to stress, and obviously don't force, like don't get into a battle of wills with your toddler.
Oh gosh, You know what? You'll never win. I'm sorry. Not. They are good.
Yeah.
They're so good. And you know that it's normal actually to be picky.
Right.
It's like 25 to 30% of all kids are picky, and that's considered normal in this age group.
Right. They're picky. Yes. They're. I mean, we all say, "Oh, my kid's picky," but it's normal. Like that is how they eat.
What happens though when it becomes like an issue? How old is it when you should say, "Okay, this shouldn't be"?
Well, I mean, it could be at any age if it's affecting growth, right? If their appetite, if their intake is so limited, either in like range of foods or amounts that it's affecting their growth, then that's obviously a problem. And you at least want to talk to your doctor about it. You might, seek out a dietitian to figure out how to handle that.
Yeah.
There's certainly good books from Ellen Satter, who is kind of the, she kind of established the whole idea about like the role of parents and kids when it's for feeding. She's got an excellent website that's a great resource called it's the Ellen Satter Institute.
Oh, yeah.
So right,
I've heard of her. Yeah.
Yeah, I mean she's really well known.
She's done a ton with kids.
She's done a ton and a lot of great resources. She's got books, but even on the website for free, a lot of great resources based on age and what you do and like your sort of regular picky kid and you're extreme picky and like how to manage all that. So I encourage people to check that out.
Okay.
But you know, so it, you know, the important thing is to like not worry and to really follow your doctor's lead, because
if they're not worried,
we tend to worry as parents, like
we worry about everything.
Yeah.
You know, even like how many times did they poop and pee? Really?
Right.
I mean,
from day one, we're worried about stuff.
Like when your baby is little, all you're obsessed about is eat, pee, and poo, right?
Oh, sleep.
And sleep. Too. Yeah. Well, yeah, but a lot of times they are only worried about sleep if they're not sleeping.
Yeah.
What? But then, like, think about, then you have this period of we don't care about pee and poo. And then, like, when you get old again, we're back to our cycle of everything revolves around when you poo.
Oh, so true.
Yeah.
We're just always looking for something to worry about.
We are.
Yeah.
Okay, so anything else? Any other things you mentioned?
I think those are the main things.
Okay.
Yeah, I'm just checking about that. Yeah, those are all. I think we covered all the things.
Okay, so we got it all.
Yeah.
And next week, what are we thinking about talking about?
Well,
we've got.
You know, we're getting.
You know, somebody asked me to do a thyroid talk, and so maybe doing the endocrine disruptors would actually be a good thing kind of to talk about, since we just added that to the list. What do you think?
Yeah.
Okay, so this time next week, be here, and we are going to talk about endocrine disruptors. Always, always, always remember that if you have any questions, you can always ask, and we will get back to you as soon as we can. And we hope that you guys have a lovely rest of your week. And we will see you next week. Thanks. Oh, and you know, you can find us everywhere. Remember that. Always, everywhere, here, YouTube, Facebook. Oh, we are on Facebook. Website, YouTube. Yeah. Are you on Twitter? I'm on Twitter, but I'm not very active on Twitter. Maybe I should be. Anyways, you can find us everywhere. On YouTube, please like us, because then you get all of our videos when they're updated and you don't miss a thing.
That's right.
So anyways, all right, we will see you guys next week for endocrine disruptors. Have a great rest of your week, guys. Bye-bye.